did follow up with, because when she went back, she happened to bump into her again. And then at the end of the week, the doctors were very excited about what was going on, and they asked me to do a lecture for them. So their doctors all got together, and they had a lot of questions about what was happening, because the patients kept coming back and saying, oh, I had this pain, and the people can lift their arm up now, just things that they didn't understand that could happen. And they've been getting therapy, they've been going to the hospital, so it really didn't make a lot of sense to them that this could occur. So I explained what I could in a short time, packed up my things, I was getting ready to leave. And as we were leaving, well, they gave me one little tour of the place just to show me what was going on. I was gonna leave, and I hear a doctor running down the ER room saying, Dr. Barron, Dr. Barron. And I was like, okay, what's going on? He goes, can you see one patient before you go? Well, I already packed everything up. The room's gone, everything's in the car, but okay, let's go. So now I go through the emergency room, and there's a young man, maybe 22 years old, who's in the room, and he says this guy has chest pain. He has chest pain that, if he takes a deep breath, hurts if he moves. He's had it for many months. I was going to take some x-rays, maybe tuberculosis. I was going to get some blood tests. But because it hurts when he moves his body, I thought maybe you should see him before you go. Maybe that's something to do with chiropractic. So I take a look at him, and of course his left shoulder's up high and the scapula is misaligned. And I show him, like, you can see how it's not aligned. That the heights are different, and the scapula is misaligned, and he has pain that runs around to the front. This is probably an intercostal neuralgia, and some manipulation of the thoracic spine and of the ribs can probably fix it. It's like, okay. So I start doing some manipulation of the ribs. Then I lay him down on a table, but this is like a gurney, so the table's kind of rolling around, I don't know. And I try to get him into a position to do what's called an anterior thoracic, but the top of the table's like moving and bouncing around, so that's not really gonna work. So I have him slide down to the end of the table, put his feet up against the wall, and I get to a place and I do the adjustment. Everything cracks. You can hear the noise of everything moving back into alignment. He gets back up and he stands back straight, and I show the doctor, see, now you see this perfectly straight. The scapulas are back in line. He'd never seen anything like this. I can't believe this is just fixed in a few seconds right in front of me. He goes, yeah, so it's all straight. But so then he starts talking to the patient. Says, well, how's your pain? He says, I don't have any pain. He says, well, what do you mean? You don't have any pain at all? He goes, no, it's gone. Okay, take a deep breath. No pain? Move. No pain. And Dr. Barron, when are you coming back? When are you coming back? Well, I hope soon. And actually, this is something that we try to set up in the future, that other doctors, chiropractors, or any other specialty, if you ever want to donate and have these experiences, let me know. I can get people into the hospital to donate their time and to do that as well. And it certainly gives you an opportunity to really feel good about yourself and to have an experience and help a lot of people. So if that is something that anyone wants to do, or a chiropractor or a specialist that wants to donate their time, you just give me a call and I could set it up, or you could probably go and do the same thing.